A very good morning to all of our students. I am Dr. Umar Nazir, working as demonstrator in the Department of Community Medicine, Government Medical College, Srinagar. Today, I will be taking a session on diet in gout. This is a subtopic on the ongoing series on nutrition. Before starting today's session, I want to quote something for my students. Gout, unlike any other disease, kills more rich men than poor, more wise men than simple, great kings, emperors, generals, admirals, and philosophers have all died of gout. So, with this, we can say that gout looks like a disease of rich than poor. Learning objectives for today's session would be introduction to gout, global burden of the disease, to know about the etiology of gout, to know about the risk factors of gout, to know about the clinical presentation of gout, its complications, how we should diagnose a gout, and lastly, to know about the preventive or dietary management of gout in patients. Now about the introduction of this disease. Gout is a metabolic disorder caused by the disturbance of uric acid metabolism in our body. It's a chronic disease due to inherited abnormality of purine metabolism. It's characterized by painful inflammation of joints, especially hands and feet, often the joint at the base of a big toe. Acute gouty arthritis attack results from elevated levels of uric acid in blood and deposition of urate crystals around the joint. Left untreated, gout can cause irreversible joint damage, kidney problems in the form of urate stones, and toffee. Now about the global gout burden and trends. The burden of gout has been increasing globally. From comprehensive analysis of the global burden of disease study 2017 on gout, burden estimates for 195 countries between 1990 and 2017 estimates approximately 41.2 million cases are prevalent in the world right now. Amongst them, 7.4 million are the new cases occurring per year, and nearly 1.3 million years lived with disability with this disease. Now about the etiology of this disease. It has been seen that gout runs in families. There is definitely a genetic predisposition for this disease. Gender and age. It has been more common in males than females, and especially the people who are elderly are more prone to this disease than the younger ones. Alcoholics have been seen to have more incidence of gout than non-alcoholic. Increased intake of food rich in purine enzyme defects is one of the causes of gouts. Due to deficiency of digestive enzyme uricase, people who have gout are unable to break down and excrete uric acid, allowing levels of it to build up in the blood, a condition called hyperuricemia that sometimes manifests as gout. Accidental exposure to lead can also lead to the instance of gout. Now about the risk factors in gout. Diet is one of the important risk factors in gout. Diets like fish, seafood, shellfish, codfish, trout, and haddock, and meat such as bacon, turkey, veal, venison, and organ meats like liver are important dietary factors for leading to gout. Obesity is also one of the leading risk factors for gout. Medical conditions like hypertension, Diabetes, metabolic syndrome, heart and kidney disease are also the risk factors for gout. Certain medications like diuretics and aspirin can lead to the increased incidence of gout in these patients. As we have already discussed about the family history is also one of the risk factors for gout. And lastly, the recent surgery or trauma sometimes can also lead to gout. Now about the clinical presentation of gout. The signs and symptoms of gout almost always occur suddenly and often at night, makes the person to get wake up from his bed. They include intense joint pain. Gout usually affects the large joint of your big toe, but it can occur in any joint. Other commonly affected joints include the ankles, knees, elbows, wrists, and fingers. The pain is likely to be most severe within the first 4 to 12 hours after it begins. Lingering discomfort. After the most severe pain subsides, some joint discomfort may last from a few days to a few weeks. Later attacks are likely to last longer and affect more joints. Third point is the inflammation and redness. The affected joint or joints become swollen, tender, warm, and red. Fourth presentation is the limited range of motion. As gout progresses, you may not be able to move your joint normally. Now about the complications of gout. People with gout can develop more severe conditions such as recurrent gout. Some people may never experience gout signs and symptoms again. Others may experience gout several times each year. Medications may help prevent gout attacks in people with recurrent gout. If left untreated, gout can cause erosion and destruction of the joint. Second complication is the advanced gout. Untreated gout may cause deposits of urate crystals to form under the skin in nodules called tophi. Tophi can develop in several areas such as your fingers, hands, feet, elbows, along with back of your ankles. They are usually not painful but can be swollen and tender during gout attacks. And lastly, the kidney stones are formed due to gout. Urate crystals may collect in the urinary tract of people with gout, causing kidney stones. Medications can help reduce the risk of kidney stones. Diagnosis of gout. Tests to help diagnose gout may include joint fluid test. Your doctor may use a needle to draw fluid from your affected joint. Urate crystals may be visible when the fluid is examined under a microscope. Blood test. A blood test to measure the levels of uric acid and creatinine in your blood. Blood tests can be misleading, though some people have high uric acid levels but never experience gout, and some people have signs and symptoms of gout but don't have unusual levels of uric acid in their blood. X-ray imaging. Joint X-rays can be helpful to rule out other causes of joint inflammation like rheumatoid arthritis. Ultrasound. Musculoskeletal ultrasound can detect urate crystals in a joint or in a tophus. This technique is more widely used in European than in the United States. Dual energy CT scan. This type of imaging can detect the presence of urate crystals in a joint even when it's not acutely inflamed. This test is not used routinely in clinical practice due to expense and is not widely available. Now about the preventive measures in gout. During symptom-free periods, these dietary changes may help protect against future gout attacks. Number first is drink plenty of fluids. Stay well hydrated by taking lots of fluids. Limit how many sweetened beverages you drink, especially those sweetened with high fructose content. Limit or avoid alcohol. Talk with your doctor about whether any amount or type of alcohol is safe for you. Recent evidence suggests that beer may be particularly likely to increase the risk of gout symptoms, especially in men. Get your protein from low fat dairy products. It has a protective effect against gout, so these are your best bet protein sources. Limit your intake of meat, fish, and poultry. A small amount may be tolerable, but pay close attention to what types and how much seems to cause problems for you. Maintain a desirable body weight. Choose portions that allow you to maintain a healthy weight. Losing weight may decrease uric acid levels in your body, but avoid fasting or rapid weight loss, since doing so may temporarily raise uric acid levels. Now, before wrapping this session, let's talk about dietary management of gout. Treatment of gout include diet of less purine content, so we had to cut down or avoid our red meat intake. In case of severe gout, purines are restricted to 100 to 150 milligrams per day. We had to avoid brain, kidney, organ liver, grain, broth, meat extract, sweet beverages, which has been already discussed in the previous slide. And we had to limit whole grain, Spanish, fresh salt water fish, cauliflower, legumes, meat soup and broth, mushrooms, oat meat and chicken. In next slide, we'll know about the medications to treat gout attacks. Now, before concluding today's session, let's know about the drugs that we use to treat acute gouty attacks. These include non-steroid anti-inflammatory drugs. These drugs are brufen, naproxen, indomethacin-like drugs. Second drug we use are the calcitonin. These drugs also reduce pain in these patients. Third one is our corticosteroids. We can give both orally as well as injectable forms of these steroids. These drugs, namely prednisolone or dexamethasone, can be used. These drugs are given especially in these patients who are not able to tolerate oral drugs of NSAIDs. Fourth one are the drugs that block uric acid production. These include xanthine oxidase inhibitors, and the drug is named as Xyluric by its trade name. With this, we conclude today's presentation on diet in gout. Hope you have been enlightened about the various dietary modifications of gout. Thank you